Sydney is falling deeper and deeper into lockdown as cases go up and up.
Based on those numbers, we can only assume that things are likely to get worse before they get better.
This level of cases, we are going to continue to see further deaths. And sadly, too many elderly people in our community are not protected.
The hot zone in the city's west and southwest has now expanded to include 8 local government areas, with the toughest restrictions anywhere in Greater Sydney.
These 8 local government areas that are now in almost total lockdown, have some very, very challenging times to come in the next few weeks.
There are a lot of angry people. None of us feel like we have any control. And with every new announcement, every new thing, it seems like we lose more control.
Western Sydney makes up the nation's 3rd largest economy, worth about $100 billion. A major manufacturing centre and home to distribution hubs that serve the nation, Western Sydney has been described as the engine room of the New South Wales economy.
We think that employment in New South Wales could fall by 300,000 over a couple of months, but those sort of figures do give you an idea of just how many people will not be going to work while we're in this lockdown.
The workforce here is highly mobile, with many travelling far and wide across Sydney. That increases the risk of spreading COVID, and authorised workers are now required to be tested every 3 days if they work outside their area. Pharmacist Mariam Ghanim travels between suburbs and gets up early to be tested.
On testing days, I will generally do them before 6 a.m. because that's when I go to the 24-hour clinic because I know there is no wait time. I think for the most part, there's general frustration and confusion. Confusion in that, at the beginning, there was a lot of confusion about who needed to be tested, why you could leave your LGA, when testing requirements started.
For casual or shift workers, it may prove more difficult as they struggle to find time in their day to get tested.
I think we need to look at how these communities are being supported, their livelihoods being threatened.
COVID spreads anywhere, but it's ripped through Western Sydney, where households are larger and incomes are lower.
The virus didn't start in southwest Sydney. It had been brought from people elsewhere in Sydney, and yet we were the ones that were bearing the brunt of the impact. And we're continuing to bear the brunt of the impact.
In Bondi, where the outbreak began, the average household size is 2.2, with an income of more than $2,000 per week. The top ancestry is English. That compares with the hotspot of Fairfield in the west, which has a household size of 3.3 and an income of more than $1,000 per week. The top ancestry, Vietnamese.
They don't have the luxury of having 2 months worth of savings that they can draw upon.
So this is my home and pretty much has been my world for the period of the lockdown. And
it's been a challenging time for Ben Ho, who lives in the Fairfield area and works from home.
And this is my missus, my wife. It's starting to, cause anxiety for all of us. My son, Felix.
3 generations live here under the one roof, and while Ben's in-laws have had their first dose vaccination, the family still takes precautions.
And also my mother-in-law as well. When they announced the first jab, my entitlement, I signed up straight away. So we're being very, very cautious.
Sydney's west is home to large migrant communities, and Ben says the messages from state and federal governments have been confusing for many.
I've seen some announcements that happen in the morning, and then there's a different one, like in the afternoon or evening. English is second language in a lot of the households here. And sometimes there is no second language.
No. Is there more?
I think the most unclear thing is around the vaccines.
What's also worrying the government is the slow take-up of the vaccine in the hotspot areas. Vaccination rates are below average compared to other parts of Sydney.
The evidence is there. If you want to protect those you love the most, Not only do you need to respect the health orders, but also encourage vaccination.
Okay, I'm just going to check the temperature, okay? Thank you.
At Dr Donghua's clinic in Fairfield, the fear of catching COVID appears to have encouraged more people to get vaccinated.
I'm just give you some hand sanitizer, okay?
This is driving a lot of demand for vaccinations at the moment. A lot of demand is for the Pfizer vaccine, but we are seeing a lot of surge in demand for the AstraZeneca vaccine.
Come through.
Dr Hua also says the federal health advice expanding AstraZeneca to adults over 18 is helping increase vaccination rates.
You happy to go ahead?
Yes.
There is a lot of mixed messaging, a lot of confusion amongst the community. There has been a fair number of patients under 40 that are coming for the vaccine, particularly those who are not eligible for Pfizer, and they don't know when they're going to get the Pfizer vaccines because they could be waiting up to 6 months before they get the vaccine. So they want the protection now.
The government is now hoping spring will provide some hope when the lockdown is due to end. But with high case numbers every day, it's relying on everyone to comply and get vaccinated.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.